so what happens for me when I'm sitting at the desk is that I'm aware of my posture and it feels pretty good, but what happens is my knees start falling out to the side. And so when I'm at the computer for a long period of time, it's the outside of the knee that just is in pain.
So when your leg drops out, it's a combination of relaxing muscles on the inner thigh and tightening muscles along the outside here. This is the IT band and the tensor fasciae muscle in the hip. And so as these remain tight, they pull out. And over time, where this comes down and attaches in here,
Exactly.
You'll feel pain in here, you'll feel pain across the side of the knee, and the goal would be to loosen this up, to stretch this out. You'll also get that popping sensation sometimes because the IT band is so tight that as you move, it'll actually pop over these bones and make a really uncomfortable sensation.
Yeah, where you're touching hurts. And also I notice as a body worker that a lot of men, this is very tight. Is that true for, it's more men than women having this trouble, or no, it doesn't have to be? Okay, because in my practice, when I mean you touch this and it's hard, the muscle's tight, it's taut.
Well, the job of this IT band is to stabilize the lateral side of the knee whenever the knee is bent. When you're sitting at the desk, your knee is bent most of the time. And so this muscle becomes active to stabilize the outside. If it's active the whole time you're sitting there, it's going to get way overworked. And therefore, it starts pulling.
Ah, okay.
So
So how do you suggest I sit? Or what do you suggest that I do when I'm in front of the computer? What's the best position for the legs at a computer desk? Is it straightforward like this? I know you just said that, raise up a little bit, but where are the ankles in relationship to the knees? What's the preferred?
well, we hope that it'll be a nice straight line.
Like this?
Yep. So that the knee is over the foot as opposed to outside the foot.
Right.
That the knee is behind the foot. So it's not
Okay.
in front of the foot.
Like in yoga? Alignment.
Yes.
Alignment.
Yes. And hopefully a nice straight line with your body. It's hard to keep any one position all the time.
Well, you know what I feel right now is in my gluteal muscles. Just sitting here for the last few minutes, I feel squeezed in my piriformis right now. To keep my knees like this, I have to hug in.
Yes. And that, of course, will further intensify any contraction you have in your piriformis, which, of course, leads to other problems.
Okay, well great. I have some somatic exercises. This is specifically for the desk worker, and I'm going to show you an exercise because for me, sitting at the computer for long periods of time, I'm starting to get pain in my knees, and I discovered that my iliotibial band is really tight, and so it's pulling my knee out to the side. And also my gluteus muscle is pretty tight, and anyways, all I know is that I'm very uncomfortable when I stand up and I walk or I squat. So anyways, this is really easy to do sitting at your desk. One way to engage this muscle to make it longer is you put your hands to the outside of your knees, and you press your knees in opposite directions so that you're basically engaging the outside of the thigh muscles here. So just squeeze and then slowly release the squeeze so the hands are pressing and the knees are coming in. And then at some point you'll feel that you're at the end of your range of motion and then you let go. So basically, even though my knees are pressing this way, my hands are pressing this way, and then my hands are winning as the legs come together. So let's try it again, ready? So pressing out, you're going to feel this outer muscles of the thigh and into the buttocks contracting, and then slowly let go. And before it comes into a stretch, then stop and relax. And we'll do it one more time. So press out, close your eyes and notice where you feel the contraction. And then slowly release. And rest. Good. And let's do the opposite muscles on the inside of the thigh. So place your hands on the inside of the knees. Squeeze your knees together, but press your hands so that you have something that you can resist against. And then slowly open. Make it smooth and go slow. And then stop when you feel like you have the full range. Now I could keep going to make it into a stretch, but that's not the goal for this video. Okay, let's try it again. Squeeze the knees in. We're keeping this more of a panasomatic re-education. Another fancy name is neuromuscular re-education. So the brain is witnessing the release of the muscle. Once you get to the end of your range, then stop and relax. And then maybe wiggle out your legs, shake out your shoulders. And this might be a nice time to sit up and notice if you feel a difference from before and after.